Okay. Hello, hello. Happy Sunday, everybody. I am Dr. Judy, as you know, also known as a plant based MD, and I help professional women heal from chronic disease, feel less stress, all in the context of their faith. I am currently sitting in my home office and I'm streaming to YouTube, Instagram, and Facebook. Although I don't actually know if it's streaming to any of them, but I'm recording it. So we'll see. But I wanted to jump on here and share with you a couple of updates. So over the past year, if you have been following me, you may know that I had a health issue. I was having some weird symptoms that led me down a rabbit hole, basically, of having to navigate the healthcare system myself. And I discovered that it is ineffective at managing conditions that are not well known, it's ineffective at healing, and it completely ignores the mind body connection. And I also learned through that experience some important things about prayer that I want to share with you if you are a person of faith who prays to a God. And these insights are things that I had never been aware of prior. I grew up believing in God, having a relationship with God, but the insights that I learned over the past year really were just mind blowing. So I have to share them with you. What you will notice going forward in my platform is even more authenticity and transparency than you have seen before. I've always been a transparent, honest person. I believe that's the only way to be. God knows your inner thoughts, so it's no sense lying to yourself and other people and pretending to be something you're not. So that's never been something that I have ever done. I am the same way all the time with everyone. I don't know how to pretend and be something that I'm not. So authenticity, transparency is a core part of who I am. But what you will start to see is I'm going to start calling out things as I see them, things that I feel need to be better in our healthcare system, things that I see and have learned are tragically flawed. And it may catch you a little bit by surprise and be like, oh, well, she's a doctor. Oh, she's saying that. But the things that I'm saying really need to be said. And the perspective that I have from over a decade in practice, I finished residency 2013. So, yeah, about a decade, in practice. And over the past 6 months, 7 months, a year, it's been really a year or two, but really the last year was when a lot of things occurred. I really learned that our healthcare system is flawed, like in a tragic way. It's very good for catastrophic care, it's good for emergency care, but it's terrible at really actually healing and getting to the root cause of things. And I've always been one that felt that Western medicine was lacking in its focus on nutrition and prevention. As you know, I've been preaching plant based nutrition forever, but I really didn't appreciate until I got into the patient side how frustrating it is navigating the healthcare system. It's incredibly frustrating. And I cannot even imagine how that experience is for people who don't work in healthcare, who don't understand the language of healthcare. One thing that I noticed is that front desk staff and people in the clinics, in the hospitals, on the telephone when you're trying to make an appointment, they act like you're stupid. They act like you're bothering them. And I'm like, but you're paid to make appointments. You're paid to check in people. If you're a nurse at the clinic, you're paid to do this. So why do I sense an attitude from you? And I've experienced this several times in multiple offices where it's like they treat you like you're stupid, like you don't know. And I always have to like assert myself because I'm a very assertive person. I am very articulate. I'm detail oriented, a little bit type A. So you can't pull the wool over my eyes. And so they always I feel like they act like you're stupid. And then, when I start to speak, I ask questions, I challenge, sometimes it's like they may not like it, but as a patient, I felt like I'm here to get care and I need to advocate for myself because y'all aren't making my health a priority. So I have to make my health a priority. And so this experience has really, really opened my eyes to what it may be like for some of you who have a chronic illness, who maybe you don't work in healthcare, you're not a doctor, right? So you're not going to get that level of respect that I typically get when I enter the healthcare system. Um, Once they find out that I'm a doctor. Now, before they find out I'm a doctor, they treat me like regular people, which I found is actually very poor. Sometimes I felt like they treated me like trash. And it really made me upset because I'm like, is this how people are getting treated when they come to the doctor's office? Um, and it's not being treated by the physicians like trash, but it's like, I felt like sometimes the nurses, the front desk staff, the secretaries, the phlebotomists, everybody just acts like they're just irritated. And I couldn't understand why. But one thing that I learned from that experience that is that if you have a chronic condition, and you only get all of your care within the insurance model, you are getting Walmart quality care. You're getting Dollar Tree care. And I say that with all of my heart because I really wanted my physician colleagues to really get to the bottom of the weird symptoms that I was having. I wanted them to diagnose me. I wanted them to come up with a treatment plan that was effective and to figure out how I could heal. I wanted to use my insurance for everything initially. And so that's what I was doing. I was seeing a bunch of different specialists. And as you know, if you go to a clinic that's in insurance, the visits are too short, 15 minutes, 30 minutes tops, which is not enough time to get to the bottom of anything. That's barely enough time to get you to tell you a story and for them to write a prescription. It's really like a factory meal. It's like so ineffective. It's just ridiculous. And so I was doing that for like 2 years. And then finally, it got to a point where I was like, no, I want better. I want better. And so I finally forked out and, dug in my pockets and went to see a doctor who was a naturopathic doctor, of course, out of network. His visits were 350 for an hour. It was the best money that I had spent so far on healthcare. For the first time, I felt truly listened to. I felt like he really wanted to get to the root. I felt like he asked questions that no one had ever asked me before. And the visit actually went over, I think it was about an hour and a half. He did a very thorough, detailed history, physical exam, prescribed some supplements, made some recommendations. And then, most of all, he gave me hope, which no one had done that before. He gave me hope that I could completely heal, which was just priceless in and of itself. And that started a catalyst of chain events in my mind where I became, and I like to call it the CEO of your health. You have to become the CEO of your health. And that means that you take control. That means that you guide your primary doctor, you guide the doctors that are taking care of you. That means that you become the expert in your health condition and go online and learn everything that you can about that health condition. And that's what I did. I read so many articles. I joined Facebook groups with people that had similar symptoms. I watch webinars, and I basically became the expert in this. And I basically told myself that I am going to completely heal. And then I saw another physician out of pocket as well. I saw about three doctors out of pocket. One was 500 for for an hour consult. One was 350. Another one was 350, something like that. But it was so valuable, and some of them I saw three times. I probably spent like $3,000 out of pocket just from appointments, from seeing these providers. And that was very key for me because I realized, wow, if I had stayed with that same mindset of only wanting to stay within the insurance system and only use my copay, I would have never known that these healing modalities that I have now learned, I would not have known that they existed. I would not have had the opportunity to actually sit down with a physician, a doctor, who actually is going to take the time to get to the bottom and ask detailed questions. And so that's lesson number one. If you're a woman, man, you have a health condition, you have a diagnosis. If you're okay with being sick and taking medications, that's fine. Keep doing what you're doing. Stay in the healthcare system. They'll write you prescriptions. You'll be on them forever. And, that's that's what it is. But if you're someone who likes to be medication free, like you don't really like taking medications like me, or you really want to heal, like you're like, no, sickness is not the norm. Something is out of balance within my body and I need to do something differently to heal. You will have to go outside the insurance system. You will have to pay money out of pocket to either hire a coach, a consultant, make an appointment, take a course or a program, and invest in your health. Because what you need to understand about the healthcare system is that it is for profit. They put profit over people, and that's just a fact. And I'm telling you that because I know I've worked actually for two insurance companies in the past throughout my career, and that's what they do. Yes, they do provide a necessary service because healthcare costs in this country have skyrocketed and did skyrocket, right? So that's why insurance companies came into place to kind of curb the cost. But the problem is that they have an ulterior motive, and their motive is not for us to be healthy. Their motive is to make profit. That's point blank. That's like just facts. And anyone that denies that is just lying to themselves and to you. Okay, so insurance companies are about money first. So you have to understand that. And so expecting them to put your health first is a bit delusional. It's not going to happen. Okay. And I know some people, when I had a lifestyle medicine practice briefly, and people would ask, oh, do I take insurance? Do I take insurance? And then when I say no, some of them didn't want to make an appointment. But if you want to heal, if you have a medical problem and you really want to get off medications, you need a doctor who's going to spend more time with you. And you need to also be willing to think outside the box. So I have a program, it's an 8-week program where I coach women of faith through the process of healing their body from the inside out. It is called the P3 program, and the next program is going to be in June. And this program is like none other. I've taken my expertise as a internal medicine doctor, a holistic physician, and now my experience dealing with this broken healthcare system to come up with a program that I know that you need if you are someone who wants to heal from chronic disease. You need support. It's like having a doctor in your pocket because this is what else I figured out and learned. And I hate to say this, my doctor's amazing. I love her. She's excellent. But still, she's too busy. She's in the healthcare system and the traditional insurance model and a regular practice. And what a lot of people don't know is that primary care doctors have between 2,000 to 3,000 patients. How much attention do you think they can give you if they have that many patients? They just can't, right? So I know how many times have you called your doctor to refill a medication and it takes a couple of days to get a response? Or you have a question in the evening, the clinic is closed. You call the on call number, and they may or may not be helpful, but most of the times they're not. They may send you to the ER, although you probably don't really need to go to the ER, but they don't really give you any useful information over the phone sometimes. That's how I felt, right? But in my 8-week program, you actually have a doctor in your pocket who we have a chat. It's not a one-on-one chat like a text message, but it's a group chat. But you can message me in the group there, and during business hours, of course. But I go above and beyond, so I probably won't answer it in the evening. But that way, if you have questions, you can kind of have someone who can help you and help guide you through that process. So that's one thing that I offer for my clients in that program. We also go deep into your diet. So I am a believer in plant-based nutrition, but I'm not a vegan, and I don't think everyone needs to be vegan. I am not vegan. I had been fully plant-based for 6 years. Although when I started to have these symptoms, I was having like headaches, fatigue, problems concentrating, tachycardia, GI symptoms, and some other things. And I was already plant based, so I had to change and do something different. I cut out gluten. I started eating fish to get omega 3s. I started taking omega 3 supplement, eating more flax seeds like every day. I eat omega 3 sources every single day. And then I also made some other changes to my diet. So I believe that diet should be customized for the individual. I don't think that diet is a one size fits all. And then also, diet is not static. So there are times in your life where you may need more protein and where you may have a hard time getting enough protein on a purely plant based diet. Because the fact of the matter is that beans, you have to eat a lot of beans to get the same amount of protein that you can get from one piece of fish. Okay, like one serving of salmon, which is a nice source of omega 3s, it's a fatty fish, has about 20 grams of protein. In order to get 20 grams of protein from beans, you have to eat like 2 cups of beans. And not everyone can tolerate beans like that. There was a period when I couldn't tolerate beans last year. I had symptoms similar to SIBO, small intestinal bacterial overgrowth. And so beans, all of a sudden, like I had issues with them, right? So I couldn't eat beans. So that's why I started eating fish and other sources of protein. Well, mostly fish. Um, and so that's the other thing. Diet is not static. Sometimes you may need to uh, eat different things, change your diet up a little bit based on what's going on right now with your health. And I think that's one mistake that people make. They get so rigid and stuck and think that, okay, I have to be fully plant based. I have to eat only this all the time, forever and ever. And I don't think anything in life is static. I think you have to roll with the tides and move with the changing seasons and listen to your body. So last year, when I was dealing with this thing, my body was literally craving high sources of protein, and I could not figure out why. And it made sense because when I started reading about the brain and inflammation and different things like that, I started to read about how ketogenic diet is helpful. So I started eating lower glycemic index fruits. I started eating more protein, not to actually reach ketosis, but I was trying to kind of eat lower glycemic index foods and kind of more on a keto-ish path. And it worked. I did that for about 2 to 3 months and um, was eating a lot of protein, basically eating green cruciferous vegetables, a lot of omega 3 fatty acids, and protein. I cut out starches, rice, pasta, bread, rice, pasta, bread. I cut that out, cut out gluten, and that's what I did. Right. But I could have been rigid and been like, well, I hadn't had a problem with gluten before. Why should I have to stop eating gluten now? No, that's not how life works. Things change. So you have to roll with the changes. Right. And so that's one thing that I help women with in my program. Some of you are stuck because you think that you have to eat fully plant based. This is thought in your head, or you think that you have to eat this way, but for whatever reason, something's changed in your biochemistry, your biology internally, something is changed. And my course will teach you to listen to your body. I think too often we don't trust ourselves. We look for answers. We don't trust ourselves. God has given us, especially as women, a very strong intuition, but most of us don't listen to it. But I'm very intuitive. I listen to my intuition and I have a very strong spirit of discernment. And so by working with me over the 8 weeks, your muscle of listening to your intuition will get stronger. And then also, I have anti inflammatory recipes. They're all gluten free, whole food, plant based. They're amazing. I really advocate for doing raw as well to help your body to heal. And then um, also, we pray together. So, part of the healing, and one thing that I think is missing from a lot of health programs, courses, and even when you go to see the doctor, it's almost like no one wants to talk about God. And I had an issue with this many years ago clinically until God started to impress upon my heart to be open for those opportunities to pray with patients. And I would be open to when it was necessary. And I would ask, is it okay if I pray with you? Would you like if we pray together? May I pray for you? And I started doing that in, the last few years of my clinical career that has now ended. I'm not practicing clinically in the hospital anymore, and I found it very very beneficial. And so in my program, what is different is that we do not ignore the ultimate healer. I don't understand how you can have a program that claims to heal people, but it's no mention of God on the landing page, in the resources, or anything. I have seen this time and time again that sometimes patients who you think are not going to do well surprise you and they recover. And then there's patients who you think might not, um, who you think might do well, and then they don't recover, or maybe they pass suddenly. So there's definitely more to healing than the drugs, the medications. I do think that God definitely is the healer. Ultimately, I think He does decide who gets healed. And so that's why I'm making a bold statement to incorporate God into my program. I think my internet's going in and out. I'm not sure. And then, so we talked about plans, we talked about prayer. That's the two P's. The third P is peace. So peace means stress free. Now, you probably heard people say you should eliminate stress, you should reduce stress. That's nonsense. When you need to heal your body, you need to eliminate all sources of chronic stress. Chronic stress is harmful to our health. And this is one big reason why a lot of people have health problems. They either stay in jobs that they need to quit that cause them stress. That was my problem. God was making it clear that it was time to leave hospital work, and I stayed, and it was stressing me out. It became a point where it wasn't even in alignment with what I wanted to do at that new season in my life. So some of you may need to quit a job. Some of you are in relationships with people that you need to cut off because they are toxic, emotionally abusive, or they are literally impeding you from being able to hear God's voice. And so when I was trying to heal, I had to make strict boundaries between even family members who are, what's the word? Toxic. Yeah, I would describe this particular individual as toxic, right? People that kind of get up in your head and speak negativity, who just bring you down, who really just are not about building you up. You don't need that in your headspace when you're trying to heal, when you're trying to actually do something and move to the next level. And so in my 8-week program, that's what we address first, actually, the stress reduction piece, like helping you to identify whether you have stress, chronic stress, which most people do because we think it's normal, but it's not. So helping you to identify chronic stress and then helping you to figure out how do you can eliminate it. Eliminate it. I assure you, it is very possible to live stress free. Okay, Jesus did it. Do you remember the story of Jesus in the boat when there was a storm and Jesus was sleeping and the disciples were panicked and they were like, Lord, 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 how can you sleep in the storm? And he's like, why are you people panicking? Relax. And so, if anything, that's how we should be. We should be able to be calm in the midst of the storm. And what I really feel in my spirit is that there will be some rough times that are going to come on this earth pretty soon. The pandemic was a wake up call. A lot of people are still asleep, but I'm sure you've probably noticed there's more wars, more people unaliving themselves. And what I'm really concerned about is that there's going to be more calamities, more pain, more suffering, more things coming. And so, in preparation, God has really put on my spirit that we need to learn how to be comfortable with being uncomfortable. We need to increase our resiliency and our tolerance for pain and suffering because a lot of us fall apart at the slightest view of anything uncomfortable. And how can that be if you're a believer, you believe in God? God knows everything. He knows everything. So all we have to do is just trust in him. And so that's another piece of what we work on in my program, helping you to trust God fully, depend on him completely. And we give you hope. What I discovered is that hope is actually the most important part of the treatment plan. And a lot of times as physicians, we want to be practical. We want to give you statistics of the prognosis of your condition, and we want to be realistic. But what I found is that that doesn't really help because God works in the unlikely. Like, what's the likelihood that I would have gotten into medical school? Wake Forest School of Medicine has a 1.5% acceptance rate. No one in my family is a doctor. The statistics and the likelihood of me becoming a doctor are extremely slim. But God said I was going to be a doctor, and it happened, right? So statistics and the prognosis is really less relevant. And I think as well, when you have a prognosis that is negative or unfavorable, what happens is that you become hopeless and you think to yourself, well, I can't do anything about it anyway, so I might as well eat what I want, right? So you're like, I'm getting my junk food, I'm gonna smoke my cigarettes. It don't matter. I might as well just do what I want if I'm gonna not recover and not heal. But that's the wrong way to think about it. You have to have hope and you have to think that you will heal and you have to think that you will recover. And so these are some of the key essential pieces that are part of my program, my brand, and everything that you see going forward from the Plant Based MD will be coming from this lens. And I assure you, there is no program like it. And it's not cheap. I'm going to tell you that right now. It's not cheap because I am a high quality woman. If you've taken anything from me, you know that I over deliver. I am a person of excellence, but you will get results and the benefits of what you will get when you sign up for my program is so much greater than the little bit of amount of money that I'm going to charge you for it. Okay, so I'm going to talk for 26 minutes. I could talk for so much more time. This is so fun. But anyway, so I just wanted to just jump on here and just share just updates of who the plant-based MD is right now, where I'm going, and I am excited. Those of you that have been following me for a very long time, thank you so much for your support. I look forward for your continued support when you sign up for my program because those of you that want to be healed, those of you that have any conditions such as autoimmune disease, cancer, lupus, MS, long COVID, prediabetes, diabetes, hypertension. What else have I not said? Chronic fatigue syndrome, chronic pain, fibromyalgia, things like that. The condition that or the symptoms that I had, because I'm not even taking ownership of that, like as that's me. That's another thing. People let their diagnosis define them. The symptoms that I had can be classified as it's very similar to chronic fatigue syndrome or myalgic encephalomyelitis. But in about 8 weeks, instituting the framework and methods that you will learn in my program, I was able to eradicate those symptoms. So as long as I got my sleep, stick to the plan, I'm good. All right, so that's all for now. If you are not on my email list, um, you need to be. I'm going to be starting to share about a plant based prayer challenge that's coming up. And it basically gives you a taste of my P3 method. And so if you're thinking about the program, I encourage you to sign up for the challenge. The challenge is only $47. Like it's like a no brainer to sign up for. I have a journal workbook that's like 14 pages. And then I have like a recipe book with it. Some recipes. It's like 14 pages, right? So like the booklet alone is worth $47 and it's a 3-day challenge. And I'm going live each day on Zoom. You got to interact with me live, ask questions. I'll be teaching. Day one, we'll be teaching about, so the 3 days, we'll be covering the P3 method, prayer, peace, and plans, and going deeper about that. And then we'll also be fasting, which is a key part of healing. Water fasting, not eating. And that's also beneficial for spiritual health as well. Okay, so that's all today. Um, if you're watching on Facebook, check me out on YouTube, subscribe, follow. I also have a podcast. If you're watching on Instagram, go to Facebook and follow me there. And that's all. All right, guys. I will see y'all later. And whatever platform you're on, if you're interested in the challenge, send me a DM with the word challenge. It's a 3-day plant-based prayer challenge that is on May 14th to the 16th. Alrighty. Thank you. See you later. Bye.